Hi everybody, it's Honest John, and Happy New Year to you all. Today I'm going to take on what's known as dissociative identity disorder, also known as multiple personality. Now, not everybody with dissociative disorder develops multiple personality. Sometimes they just have memory loss, and they have what are called fugue states, which are kind of like trances. Uh, so the basic characteristic of this is that you just lose time. You have no memory of what went on for a certain period of time in your life. Uh, but the multiple personality disorder, now this is a very controversial diagnosis. Uh, there are many people in the psychiatric community who insist that it really doesn't exist, and that uh, people with multiple personality disorder are actually very suggestible patients, usually with what's called borderline personality disorder, which I will get into in a future video, uh, who are kind of led into having multiple personality disorder by their therapist. And one of the arguments that they make about this is that uh, there are a small number of therapists who appear to uh, do most of the diagnosing of multiple personality disorder. Uh, those therapists, however, argue that they just are more knowledgeable in that and more open to that. Now, that aside, uh, we will kind of uh, not deal with the controversy in as much depth as we could, because there's a lot about it. Uh, and just move on to uh, assuming that multiple personality disorder does exist. Now, I have worked with a couple of patients who had that diagnosis. I have to say right here and right now that I was a very, very small, my contribution was very small in that area. I was not a major part of the therapy team. However, I did have to have contact with these patients, and did some work with them. Um, Now, multiple personality disorder appears to be associated with trauma. Uh, Most of the patients, as a matter of fact, just about all of the patients who develop multiple personality disorder were either physically or sexually abused as children. Uh, and the development of these separate personalities appears to be a way of coping with the trauma. The separate personalities have information which the others don't. Uh, it's, in some cases, multiple personality disorder, there are just maybe might be one other personality. In some cases, there are many other personalities that that form, and most of them are not aware of each other. Although sometimes some of them are. Uh, and so the base personality usually operates under the given name of the patient, and uh, and it usually has the least awareness of any of the personalities of what's going on. Uh, and this is a way the other personalities are formed to protect the the base personality, the main personality, whatever you want to call that. Uh, and the other personalities will not all be the same sex as the individual. Uh, There are females will develop male personalities. By the way, the number of females who develop multiple personality disorder is about 3 to 1 more than males that develop this disorder. And believe me, it creates chaos in the person's life and unstable relationships. Imagine being in a relationship with someone that sometimes is a completely different person. One of the women I worked with reported suddenly finding herself running down a dark street with a man chasing her. Evidently, one of her personalities had gotten her into a jam and then jumped ship. So it creates a lot of difficulty. The base personality is usually the weakest personality. The other personalities tend to have strengths that the base personality doesn't. The base personality is usually kind of passive and very guilt-ridden. Now, the treatment of multiple personality, anti-anxiety medications are used, but there is no medication that actually treats the disorder. The disorder is treated. The main focus of the therapy in treating that is to process the various traumas and abuses that occurred in the person's life, and thereby integrating the other personalities into the base personality, which strengthens the base personality. And part of the reason for the controversy with multiple personality disorder is because they have so many comorbid illnesses. They may suffer from depression, anxiety, eating disorders, substance abuse, PTSD. So they're very difficult to work with. And now staff, when you're working at a hospital or a clinic, what staff needs to do mostly is pay attention. You need to know which personality you're dealing with. Actively listen, be accepting. And even if you're skeptical about the diagnosis, you don't want to express that. And it's important for the staff to resist the temptation to probe. Leave the psychoanalysis to the doctor. Take a low-key, matter-of-fact approach. Set clear limits on behavior. And be supportive. Create an environment of acceptance. And most people with the diagnosis of multiple personality disorder do manage to function adequately in society for pretty long periods between acute episodes. But, as I said, their lives tend to be very difficult and chaotic, and relationships are problematic. By the way, your girlfriend or boyfriend, who sometimes appears to be a different person, is probably not suffering from multiple personality disorder. They're just moody and bitchy. Thanks for listening.